We good? Are we on?
Yeah.
Yes.
Everybody get different locations.
Various
Can you do a
angles.
countdown? I'm just kidding.
So like everything else, always orient. Top of the skull, superior dorsal, anterior, ventral or inferior, posterior. To start on the list with the sutures, 4 of them. So again, front, back, coronal suture, connecting frontal to parietal bones. Sagittal suture, connecting the 2 parietal bones. Lateral view, side of the head. Squamosal suture, connecting temporal to parietal, and back of the head. Lambdoidal suture, occipital bone to the parietal bones. First bone listed, frontal bone. Stay here, your forehead. This structure here is called the glabella. So like if you furrow your eyes, this is where you're furrowing, the glabella. The structure here, shown kind of weirdly, is the supra above orbital, above the eye socket foramen, a hole, supraorbital foramen, and the 2 parietal bones, temporal bone, and then a whole bunch of parts in the temporal bone. External auditory or acoustic meatus, either one's fine. And inside of the skull, skull cap off, looking in, so your brain sits here. Inside of the skull, this is temporal bone. This here, internal auditory or acoustic meatus. Back to a lateral view. So the structure here we'll see again, this is the zygomatic arch, temporal bone. This is the zygomatic process of the temporal bone. These 2 bumps here, different angle here, mastoid process, styloid process, the stiletto one. Between them is a hole, the stylo-mastoid foramen. Mandibular fossa is under here, so these are pieces of plastic. I think I have some skulls where they're missing, so those are out. So there's an indentation there, or a depression. That's where the mandible articulates, give you the temporomandibular joint. Maybe 2 more holes. So from this view, very specifically, so only the ventral view will I test the jugular foramen, and then just in front of it is the carotid canal. So you can see them carotid, jugular. Jugular's just kind of bigger and it's like squished. The carotid is very round. But only from this ventral view do I test those 2 holes. Occipital bone starts here and then goes underneath, so that most of the inferior view is occipital bone. This is the foramen magnum, big hole. On either side of it are 2 processes that stick up, and they're articular. These are the occipital condyles. And then the hypoglossal canal, I do from this view pretty specifically when I test on it. So inside of the skull, when you look down here, go with that one there. That's the hypoglossal canal. Kind of in here, kind of in the foramen magnum. Sphenoid and ethmoid, I'll show you here, and then there are the disarticulated versions as well. So again, skull cap is gone. We're inside the skull, superior view, ethmoid, sphenoid. So sphenoid is first. The lesser and greater wings I really test from the disarticulated version, but here's the lesser, here's the greater. This indentation here is the sella turcica. Pituitary gland sits there. And this angle, 2 holes, those are your optic canals. Your optic nerve goes through there to see. And then our 3 holes, rotundum ovale spinosum. ROS, rotundum ovale spinosum. The ethmoid bone, from the inside view, this thing that sticks up is the Christogalli. either side of it, there's a flat space, so it's flat. That's the cribriform plate, so on either side. And then, not very well depicted, other skulls will show it better. All the little holes are the olfactory foramen. Nasal cavity, what you'll see here from the ethmoid bone specifically, the perpendicular plate. Sort of midline. And then this here is the middle nasal concha. So kind of in the lateral wall of the nasal cavity. Below it is its own little bone. We'll see again, that's the inferior nasal concha. So that's that. Then the sinuses. So 4 bones with sinuses, which are the cavities or empty spaces. And those will get asked question-based, so there'd be a sticker like here, name the cavity of this bone. And you'll put frontal sinus. The maxillae have a sinus, the maxillary sinus. And then the ethmoid sinus, sphenoid sinus. Again, sticker here, name the cavity of this bone, ethmoid sinus, sphenoid sinus. Facial bones. From this view, very specifically, the inferior portion of the bony nasal septum is called the vomer, V-O-M-E-R. This again is the inferior nasal concha. What we don't see, but what is on the disarticulated ethmoid is the superior nasal concha. This is the nasal bone here, so above like where your nose would be. Nasal bones. Then we go towards the eye socket. So nasal bones, this is actually part of the maxilla here. And continuing medial, there's this little bone here. It's not very well demarcated on this particular model, but you can tell it's that because of this hole here, the nasolacrimal canal. Lacrimal bone, nasolacrimal canal. Then I'm going to jump to the zygomatic bone. It's your cheekbone. Cheekbone connects to the temporal bone right here to create the zygomatic arch. This is the temporal process of the zygomatic bone. That's that. Then up to the maxillae. So 2 maxilla bones. Below the eye, infra-orbital foramen on either side. These bumps here, where your teeth go, are the alveolar processes. Ventral view, inferior view, your hard palate, made of 2 bones. This posterior part here is the palatine bone. The anterior 2/3 is the maxilla bone. It's called the palatine process of the maxilla bone. So hard palate, palatine bone, palatine process of the maxilla bone. And then lastly, our mandible, so our lower jaw, as it connects to the mandibular fossa. This will probably be out like this, but it'll be next to its friend, so hopefully you'll make sense of what it is. And again, orient, front, back, 2 bumps here. The anterior bump is the coronoid process of the mandible. Posterior bump is the mandibular condyle. Anterior view, 2 holes. These are the mental foramen. Teeth also in the mandible, sit in the alveolar processes. And then a sort of inside view. What you can see, again, this model doesn't do a great job, but these are the mandibular foramen here. And that's that.